Joshua Martin has been missing for more than a month. His family, who lives in Millard, trusted a Lincoln facility to care for him. I'm your West Omaha neighborhood reporter John Brown, and I've been following his disappearance. It's important to know Joshua's family moved him into that facility because he has schizophrenia and severe OCD. They say he functions at the level of a 5-year-old. On April 5th, he went missing and hasn't been seen since. Family and friends searched several times and even hired 2 private investigators. In addition to covering the search for Joshua, I've also been digging into the facility caring for him. I've uncovered new information that shows state regulators cited Integrated Behavioral Health Services for violations stemming from Martin's disappearance, and this report reveals what happened the day Joshua went missing. This 15-page statement of deficiencies and plan of correction from the Department of Health and Human Services outlines the investigation conducted at Integrated Behavioral Health Services in Lincoln in the days after Joshua Martin went missing. Regulators discovered on the day Joshua went missing there were not enough staff members in the facility. The state requires a ratio of 1-4 during the day and 1-6 during overnight hours. The inspector who wrote the report says that on April 5th, the facility did not meet the policy identified in the 1-4 ratio, nor did the facility have sufficient staff to supervise and prevent Joshua from leaving. I've learned Client 1 is Joshua Martin. Elopement is their word for leaving without notice. Previous accounts of the day from police reports indicate Joshua went missing at 1:30 p.m. The report reveals more information. Staff told investigators that they don't know exactly when he left, only that it happened between approximately 1:30 p.m., the last time staff checked in on him, and 2:10 p.m. After staff searched for him, they called police at 2:46. The report states the administrator verified they had no evidence regarding how or at what time Client 1 had eloped, as staff on duty had not witnessed Client 1 leaving the facility's premises. The state report also found that IBHS existing policies and procedures regarding missing clients was not in compliance with state regulations. And there's another citation. Joshua was also on an individualized service plan, which required weekly review with a therapist. In an interview with DHHS, the chief operating officer stated there was no evidence of review of Martin's plan in February, March, and April 2024. There was no rationale stated as to why those reviews were not completed. I asked the facility for an on-camera interview or even just a phone interview several times. They declined, citing privacy laws. Neither the state nor the facility provided Joshua Martin's family with a copy of this report. The first time they read it was when I brought it to them.
It's very agitated, angry, just in dismay.
Martin's aunt Carrie Johnson told me in person, and his parents told me over the phone, they now question everything they thought they knew about IBHS.
A place that was supposed to be housing people that had special needs or disabilities, were supposed to be there to protect and serve these patients, and definitely have let them down and have let their families down.
And John, the story does not end here, so give us a sense of what is next.
Mary, the facility has submitted these documents which show a plan of correction, and the state has accepted them, but Joshua Martin's family tells me they're still looking for answers, and he's still missing over a month later.
It's hard to imagine being in their shoes, John. Thank you for staying on top of it.